네 번째 연자는 동의대학교 한의과대학 권창영 교수입니다. 정신과를 담당하고 계십니다. 이번 코비드-19는 신체적인 증상 외에도 장기간 격리로 인해 예상하지 못했던 우울, 불안, 불면증을 호소하는 경우가 많았습니다. 한국에서는 전화진료단이 시간을 더해 갈수록 호소가 많아지는 이러한 증상에 효과가 있는 처방을 추가로 준비해서 투약하거나 명상법을 안내하기도 했습니다. 이런 현상에 대한 의견을 주실 것입니다. 발표 제목은 Mental Health in COVID-19 Era Use of Mind-Body Medicine in the Telemedicine Center입니다.
Hello, my name is Kwon, and I am affiliated with Dong-eui University College of Korean Medicine. Today I will be talking about mental health in the COVID-19 era and use of mind-body medicine in the telemedicine center. My talk today is mainly divided into two parts. The first part is on papers published after the emergence of COVID-19, lessons from existing evidence, and some promising strategies. The second part is on use of mind-body medicine in the telemedicine center and some suggestions. I will start with part one. As you already know, the impact of the COVID-19 pandemic on mental health is spreading and growing rapidly. First, the impact of the COVID-19 virus on mental health started with China, and its impact on medical staff, confirmed COVID-19 patients, and the general public was established. These reports especially increased starting with March this year. As the COVID-19 virus spread from China to the world in the Americas, the United States and Brazil, in Europe, France and Italy, and even Africa showed reports of mental distress. The reports have been continually made regarding its impact on mental health, including insomnia, anxiety, depression, psychological trauma, distress. Although in Korea we do have reports that have been established, unfortunately, they have not been published yet, and so I would like to introduce some studies that have been made by our research teams. As described by the other presenters, characteristics of individuals receiving telemedicine mental health services was assessed. Unfortunately, a validated mental health assessment tool was not used. However, NRS was used to assess the 8 symptoms that are listed on the lower right corner. The 4 symptoms of overstrain, fear, anxiety, and insomnia were shown to have a mean of around or over 5. Although the study is limited in that it did not use validated mental health assessment tools, and the scores before and after the COVID-19 pandemic cannot be compared, even with the limited data that we have, we can determine and know that for the patients visiting our center and for the general public in Korea, the impact of COVID-19 on mental health is substantial. Along with the spread of the impact of COVID-19 on mental health globally, which populations are especially vulnerable to COVID-19 impact is of interest to us. First, the studies were conducted on medical staff and COVID-19 patients, and further on I will be talking about this more, but however, I would first like to introduce a study of ours. This is our study on unpublished data, and upon assessment of characteristics of COVID-19 patients with insomnia who received Korean medicine telemedicine services, we retrieved the data that 10.5% prevalence was shown. Further, although not diagnosed with COVID-19, influence and impact in the general public and population has also been collectively and widely reported. An area receiving more interest relatively recently are studies in the mental health of vulnerable groups, which are also being published. This includes studies in ethnic minorities, older adults, children and adolescents, and women, and patients with a previous history of mental disorders, and individuals of lower socioeconomic status have been shown to be more vulnerable. A recent systematic review has reviewed the psychological and mental impact in diverse populations and aggregated the data. Especially regarding anxiety and depression, a prevalence of 25% to 30% has been reported. As seen in the figures on the left and the right, the studies show very high heterogeneity. The reason for this high heterogeneity may be attributed to the difference in tools for assessment of mental health. However, personally, I think that the influence of socioeconomic and cultural differences by nation is also attributable. I will be explaining this in more detail afterwards. Also, regarding the second wave, especially centered around the US, the impact of COVID-19 related deaths is also receiving attention. In Korea, the impact on mental health of COVID-19 has been receiving medical and social attention, and so newly coined words such as Corona Blue, Corona Red, and Corona Black have been newly coined. And also the new term of 심리방역, disinfecting one's mind, has also been coined. Corona Blue, as you can guess, refers to depressive symptoms. Corona Red refers to anger, and Corona Black refers to hopelessness and emptiness and increased risk of suicide. I personally am interested in COVID-19 red and black because I think these especially reflect the cultural and social aspects. For example, COVID-19 disinfection is not only governed by medical and scientific evidence. This is because the social safety net has also to be considered. And in establishment of social safety nets, the judgment of politicians has to be involved. So if a politically differently dispositioned politician were to be in power and set isolation rules and regulations that especially are not consistent with one's medical and scientific beliefs, these rules and regulations and judgments may lead to individuals' anger. Also, social isolation and quarantine restrains and restricts individuals' freedom of confirmed COVID-19 patients may also lead to anger. Anger in Korea is especially manifested in non-expression of anger, as 화병 in somatized symptoms. And overseas, there are more reports of more active expressions of anger, such as aggression and violence. Corona Black refers to the impact, especially in vulnerable groups, such as the disabled and those with low social economic status, or heavily impact economically. This leads to Corona Black. So this reflects not only the mental and psychiatric aspects, but also the socio-economical aspects and cultural aspects also. Another axis of the studies on the impact of on mental health is regarding what the direction of influence on mental health is. Studies have been published on the results in patients with direct infection of COVID-19, how their nervous and immune systems are affected, and afterwards their mental health. Also, various stress factors that are related with COVID-19 may also have indirect influence. Next, for the WHO survey, which was recently published. Mental health services which have been provided for mental health disorder patients, especially for vulnerable groups, has been disrupted. Next, for a recent study, that is a large-scale retrospective cohort that was reported in the U.S., reported a bidirectional association between COVID-19 and psychiatric disorders. So bidirectional associations with COVID-19, confirmed COVID-19 patients with increased risk of psychiatric disorders developing afterwards, and psychiatric disorder patients with increased risk of being confirmed and diagnosed with COVID-19 was shown. In aggregation of the previous studies and lessons that we can learn is that mental health problems caused by COVID-19 are prevalent around the world. Second, COVID-19 may affect our mental health longitudinally and transversely. After the first and second waves, we may have to expect a third wave due to the prolonged impact, and various factors may have indirect influences, such as through large-scale deaths and also socioeconomic impact, which lead to widespread influence on mental health. Various studies have been conducted in medical staff, COVID-19 confirmed patients, and the general population. However, in the future, more studies should be conducted in vulnerable groups. Next, I will explain some cases, some vulnerable individuals that have been visiting our clinic. There was a female adolescent patient who, due to social distancing, could not regularly attend special education school, and due to this, agitation and insomnia worsened. We also had an elderly female with a history of MDD who, due to social distancing, regular visits to welfare centers were suspended and the depressed mood worsened. Also, a patient with dementia staying at a nursing home due to social distancing, visits by caregivers regularly were very limited, and so he was not able to conduct the usual walks and could not receive emotional support, and so the BPSD symptoms worsened. Also, in the case of a female individual with neuroticism, after contact with a confirmed COVID-19 patient, she experienced extreme fear of an infection. And because of those worries, showed somatization symptoms. Next, regarding economic impact. After being laid off work and with a low socioeconomic status, a patient came in with chief complaints of anxiety, headache, and insomnia. So I believe that we should pay more attention to such individuals of vulnerable status. There are reports of negative influence due to economic aspects and also from excessive exposure to social media. As shown in the lower right-hand corner, social isolation and various negative results, such as negative thoughts regarding the development of vaccines, becoming delayed and worrying too much regarding these negative results may have a negative influence on mental health. We talked about how in the U.S. cohort study, the mental health and COVID-19 seem to be linked bidirectionally. And going back to the WHO study, countries show discrepancy regarding in their capability to respond to COVID-19, especially regarding mental health. Many mental health experts are worried about this matter and also focusing on it. According to the WHO survey, low and middle income countries are especially unequipped to respond appropriately to COVID-19 mental health impact and so need the support of global entities. Lastly, I will talk about the socio-economic and social-cultural factors. In journals such as Lancet and BMJ, the discrepancy between science and politics and medicine has been reported. So mental health is not only influenced medically and psychiatrically, but also through various social cultural factors. In conclusion, the mental health issue in COVID-19 era can be considered a global public health priority. Going back to the WHO survey, it states, giving specific figures, that spending 2% of national health budgets on mental health is not enough. According to press releases publicized in Korea, by 2019, this percentage was 1.5%. Although investments and spendings are increasing, still we have a long way to go. The WHO also stresses that investment of a budget on depression and anxiety returns are very high regarding the benefits, and so that budget should be increased. In this situation, promising strategies include telemedicine. Telemedicine did not emerge today. It has been around for a while, and the major advantages of telemental healthcare, including improved access, reduced costs, flexibility, potential for combined treatment with various other treatments, and interactive sessions between clients and clinicians, has made it a promising strategy. And as telemedicine is being used from active and non-active choice globally, evidence will be widely accumulated, and I consider it to be especially promising for public health and public mental health. The WHO survey reports how telemedicine and teletherapy is already being used in many countries for mental health issues and lack of resources. And recently, a panel of psychiatrists from 15 different countries convened and settled on a telepsychiatry protocol. So, in my opinion, telemedicine will be used in the future continuously and increasingly for COVID-19 mental impact. Another promising strategy is mind-body medicine. Mind-body medicine is patient-centered, and they empower patients to actively engage in self-care of health and self-management of symptoms. They also are creative and also holds the strength of easy combination with telemedicine and other technologies and treatments, and have received evaluations of being highly accessible and cost-effective. So in the WHO, it introduces basic psychosocial skills, and in the annex, it includes progressive muscle relaxation. The US CDC also introduces meditation as a healthy way to cope with stress. The telepsychiatry protocol developed by a panel of psychiatrists from 15 different countries also includes mind-body medicine, such as relaxation and mindfulness techniques as first-line treatment. In this situation, our telemedicine center also used mind-body medicine. The protocol used in our study is described in detail in the published study. Largely, 8 different symptoms were assessed in pre-examinations and history taking. In mind-body medicine, modalities were prescribed for each symptom accordingly. However, I must state that in actual application, although we did evaluations and prescriptions, the prescriptions were not made individually, one-on-one. The clients were provided general manuals and resources. And after receiving the message, they would select the mind-body modality that would best fit their symptoms. Also, a characteristic of mind-body modalities include that it has transcendent implications. What transcendent indication means is that, for example, progressive muscle relaxation is listed at the top here, and it looks like it has a one-to-one correlation with overstrain. However, progressive muscle relaxation may also be used for fear, anxiety, depression, anger, and other physical symptoms. This goes for other mind-body modalities also. So the table here does not show one-on-one correlations between symptoms and individual modalities, but more modalities that could be considered as first line, and also increase exposure of the patient to various modalities, and so it could be considered to be a process of where the patient can find the most appropriate mind-body modality for themselves. Basic modalities, there are 3 of them, and simple breathing refers to finding your original rhythm to be more stable and comfortable. Next is mindful breathing, where breathing and body sensations are observed and focused on, along with mental imaging training that makes the body feel more healthy and fresh. And walking meditation is the only mobile type of meditation here, where the patient is instructed to walk in their living room or in the yard, focusing on their body sensations through which they can feel comfortable and balanced. Feeling comfortable and balanced is the aim of treatment, and these 3 modalities are to be conducted regularly. And the aim of treatment is to increase mental health potential. Now I will talk about each individual modality. For progressive muscle relaxation, each of the individual muscles are locally tensed and then relaxed with breathing. And for autogenic training, it was developed by Dr. Schultz from Germany, and it is a type of self-hypnosis. It aims for relaxation by focusing on how the lower abdomen or the hands are warm or heavy, and the forehead is cool. Breath counting meditation is conducted by counting backwards, starting with 10 to 1 with each time you breathe in and out. It is used as a distraction method to dispel overly worrying or anxiety. Sitting meditation is conducted by sitting on the chair or on the floor. Body sensation, thoughts, and emotions are observed non-judgmentally and toleratingly, acceptingly. It is a type of training, and although it is very hard for beginners to do, a non-judgmental attitude, an accepting attitude, can be applied to not only meditation but also their daily lives. Loving and kindness meditation is increasing the love and kindness one feels for others and extending it to others, and could be considered a social type of meditation. I personally think that this type of meditation is the most important for social meaning in the COVID-19 era. Eating meditation is also included. Eating meditation is a type of mindfulness meditation. It focuses on physical sensations and the fulfillment of eventually feeling satisfied. And mental imaging training is also included through the form of imagining the energy generated through this process is filling the body with health and nutrition, and is a good type of meditation for those with a lowered enthusiasm or appetite. Body scan identifies the physical sensations in a non-judgmental and accepting manner. To the best of my knowledge, body scans were not devised for the purpose of insomnia treatment. However, clinically it induces a deep relaxation effects, and it is used for insomnia treatment from experience. Lastly, the 15-minute meditation with Qi is a meditation type that is unique to Korea. After inducing a relaxation response, the warm energy that has been focused in the palms of the hands the hands are then taken to places of symptoms and pain, as the warm energy is interpreted as qi. And at the end of treatment, the warm hands are then taken to the umbilicus or the tanjan for mental imaging training of delivering the warm energy to your body. These mind-body modalities were not only delivered by text messages, but also the YouTube channel of the Association of Korean Medicine, and these modalities are easily accessible through YouTube by the general public and those interested. However, I do have some suggestions for improvement. We adopted NRS for evaluation of 8 different types of symptoms. However, NRS is not validated for mental health use. Therefore, other presenters were able to compare the results before and after treatment. However, we were not able to do so. As we do not have results for mental health before the COVID-19 era, therefore, we should consider adopting a validated and simple form of mental health assessment that is easy to apply to smartphone applications and for telemedicine. My second suggestion regards how our mind-body modality is generally of a single direction, such as in using a YouTube broadcast. As seen earlier, walking meditation was the only type of mobile meditation. However, we do have other techniques that are mobile, such as Kwon, yoga, and Qigong, which are used commonly, and we should use bidirectional communication more, such as through use of programs such as Zoom and Google Meet, to provide a more vital and active type of mind-body medicine modality. As a last suggestion, in the mental health area, consideration needs to be given to vulnerable groups. This can be mainly divided into 2 different aspects. Firstly, regarding the mind-body modalities, and also regarding how we will approach these patients. Using technology, as those with impaired cognitive skills and the elderly are not able to access these technologies freely, as there is a gap in digital accessibility, and information that is very readily accessible to the young generations are not available to the old. So digital technology, which is more user-friendly in providing mind-body medicine, is needed. Thank you for your kind attention.